Hello and welcome, dear learners, to the course on infection control practices. In continuation with the foundations of healthcare quality and infection control, let me start with the lecture 4, where it emphasizes on the importance of quality in improving patient outcomes and healthcare system performance in Indian hospitals. Here we will be discussing on patient outcomes, examples of impact in Indian context, challenges in Indian healthcare, and Indian government initiatives. So in the previous chapter, what we saw is about how to make it about the quality, and in continuation now, we will be taking about the patient outcomes impact. The major goal of healthcare quality is to give good care so patient can get better and stay healthy. How do we say that the patients can get healthy, and how does really the patient outcome affects the quality? How does it makes that the patient outcome help measure to well understand the team in the hospital, the team in the healthcare, that how the patients can satisfied. These outcomes including like recovery, the overall health and avoiding problems during treatment. From the inside the hospitals and even during the hospital stay and even during the discharge, there are the three processes actually that if we do try to understand how the patient outcomes really gives and healthcare workers actually to understand the patient outcomes impact. The patient outcome impact actually, if we have to improve, it is important both for the moral reasons and for checking how well a hospital is performing. If we as an assessor of a quality goes and to identify how the patient outcomes really affect actually the patient's outcomes actually, which comes more into derivation of giving the more impact on the quality, the checkings actually can be seen in all the three processes that I have discussed. How can care impact the patient recovery? The ultimate aim of a physician actually tries to become more focused on the patient recovery. So we can see the indicators like better recovery rates, emotional support, effective communication, which comes with the entire team and not only by the physician. Preventing problems which can come, the problems which are existing problem to the patients, the problems which the patient may face during the hospital stay, and even the problems the patient may have with the existing disease condition and with the comorbidity actually we can say. Building confidence to the patient that the patient will go into the recovery by extending communication to the patient. Family support, which is very important because it is not the patient that the patient is only taking treatment. Many times it is being seen that along with the patient's relative do care actually, and we find there is a whole lot of family support which is very important in the scene actually that the patient's recovery is being aligned. Practical assistance, which is very important to deal with the different aspects that the patient has to face, not only seeking the medication but even seeking all the different processes. And the support by the healthcare providers will also improve the patient recovery. Continuity of care, which is very important, where one aspect the patient may come up with a follow-up, or the patient may even come up for the first time, or sometimes a chronic patient who comes repeatedly to a hospital. Morbidity and mortality, which is very important, where morbidity is more counted towards the disease condition and the gravity or the severity of the infection, which affects actually the disease condition of the patient. Mortality is more towards the disease or the fatalness or the seriousness which may lead to death of the patient. Reducing hospital readmissions. Why it is so important to discuss about the reducing hospital readmission? It is more like whether it is more because of the infection that the patient has caused, that is healthcare associated infection or hospital acquired infection, or sometimes it is more because of the ailing condition of the patient, might be because the disease has taken a long stay, or sometimes because of improper care the patient again has to come for the hospital. And this is where we can say reducing hospital readmission also impacts the entire patient recovery. And we do come across a lot of these incidences that patient has or patients are really facing this issue, particularly in public hospitals. If do we take the examples of impact in Indian context where the healthcare institutions and hospitals are facing, The example of impact actually reduced by hospital acquired infection. You might have heard about that it is also said that Indian hospitals are breeding grounds of infection. Lot of infections which are taken are more not only because the hospital doesn't have infrastructure or the hospital doesn't have enough staff. It is more because of the quality practices that are not followed in the hospitals. Hospital acquired infections are infections the patients get during medical care or shortly after discharge. Lot of the hospitals are encountered with lot of procedures actually which takes a mix or even a single settings. Sometimes you may have a single specialty hospital, sometimes you may come across with a multi-specialty hospitals. But the boots of infections or the superbugs which are taking care in the hospitals are more managed by the quality practices. So the HAIs may be caused by bacteria, viruses, fungi or parasites. A hospital may have even a mixed load of all these. The patient might get the HAIs even before coming to the hospital, where the hospitals are more forget with actually with all these infections. The patient may also get HAIs in contact actually with the healthcare workers. Even the healthcare workers are also equally a possibility of even acquiring this infection. Quality management helps improve care and reduce infections. So quality management practices works on HAIs. The hospital acquired infections where the patient gets the infection after coming into the hospital, after stay into the hospital, or sometimes the disease conditions are increased with additional infection. So infection prevention programs use training, hand hygiene practices, safe environments, care bundles, antimicrobial stewardship programs and monitoring system. All these are accumulation of giving infection prevention programs. Systemic quality tools like risk of HAIs and improve patient outcomes are in a line actually to give lot of impact on reducing the hospital acquired infections or healthcare associated infections. So in the discussion with the HAI examples, I just want to highlight few examples of impact. How improved maternal and child outcomes also affect actually the quality. We do find that majority of the patients which are coming to the hospitals are from the most vulnerable groups like geriatric patient, pediatric patient, mothers and patients with chronic disease condition. A mother's health during and after pregnancy, where we can say the ANC, the antenatal care and the postnatal care affects both her and her child's well-being. So mental illnesses and poor mental health can lead to negative outcomes for mother and the child. The entire child care actually will be affected if the mother's illnesses is more, or sometimes we may find the nutritional level of the mother is very poor and the outcome of the health of the mother will be reflected more on the child health outcomes. It is very interconnected actually that we need to see this improved maternal and child health outcomes, particularly when we come across the pregnant women. The other factors affecting maternal health include medical conditions. Now we find that a lot of increase in gestational diabetes and even hypertension. Patients who are affected with obesity, patients who are affected with other health or heart conditions also come across with lot of increasing delivery issues and or we can say high risk pregnancies. Stress is one which fuels a lot into the maternal health care. Age, marital status, education, employment, pregnancy type, delivery, family condition, and socioeconomic station. Or sometimes where we find the socioeconomic status actually or the poor patient or sometimes actually the patient who comes with unemployment or sometimes poor education actually or sometimes we may find adolescent health which becomes and fueling issues actually to affect the maternal and child outcomes. So if we do see that these are the social determinants of health and we have to improve, it is very important for the healthcare institutions to be very inclusive towards the healthcare part. It is not that you are physically treating the patient. It is not that only that we need to even only take up the patient's disease condition. You have to even think about the social factors actually which affects a lot the healthcare outcomes. The quality indicators need to be put aligned actually to these indicators, and we have to work on those to improve the maternal child outcomes. In continuation with this, the challenges in Indian healthcare. Indian healthcare is not void of the challenges. The variability in the care quality is all affected because of the vulnerability or the marginalized population actually which are always in denial role by Indian healthcare system. Urban hospitals may have better health facilities and specialties, and thereby we find that a lot of healthcare workers, hospital nurses are more inclined towards working into these urban hospitals, while many rural areas lack basic infrastructure and skill providers where particularly doctors, nurses are they're not interested to work into these hospitals and consistent clinical practices. So they might be seeking more job opportunities into the urban setups. They might be more interested in going to larger cities or towns actually because they find that it is not that they are not having a proper skills. But yes, the urban setups are more welcoming because of the facilities that the healthcare providers are getting over there. So this is one of the biggest challenges which is affecting the resultant patient outcome across the country. This problem is very persistent and it is growing actually. We do come across that the push of private providers actually and taking more lead into providing the healthcare is more because of the poor functionings of public hospital. Private hospital often offer better quality care because they have more resources and flexibility. And that's the plus point that the private hospitals are getting more benefits and they attract more patients. In contrast, the public hospitals struggle with overcrowding. Lot of queue, limited resources, poor infrastructure, long waiting hours, unavailability of human resources, and if though they have some diagnostics, those are very poor. So, a lot of the time the patient has to go out of those public hospitals to avail lot of these services. And that's the reason the patients are more attracted towards the private hospitals. So, variability in quality care actually is a very important issue to be discussed, and this comes as a major important challenges in Indian healthcare. Only a small percentage of hospitals have accreditation. So, Indian hospitals are not in favor actually to go for accreditation. But now, with the increase that the patients are demanding towards quality care and NABH comes as a prime role, or international organizations are also like JCI and even the culture of ISO, which is very increasing and giving more formal quality standards, which are which was not followed previously, is now being followed in healthcare special facilities. And we do come across that most of the hospitals in India are now looking towards accreditation, which is a very promising culture. And sometimes we do find even that the public hospitals are also approaching for NABH. Especially they are being more trained for NQAS, which is also satisfying the entire need of public hospitals. Many healthcare workers or health professionals do not have current training in modern clinical guidelines. And we do come across that if though the healthcare workers are not trained into the clinical guidelines, actually they affect actually the patient health outcomes. Infection control, which is a very pending and very important issue that the healthcare worker, especially in public hospitals, don't come across actually with a lot of important trainings or updated trainings actually, which is very, very important. Patient safety is the concern that everyone has to understand in the healthcare professionals or especially the doctors and nurses, that patient safety finds as a major important facet in quality. Now with the improved healthcare technology and the high-end devices which are increasing, electronic health systems plays a major role in improving healthcare outcomes. High patient number lead to fatigue and burnouts. Indian doctors come across a lot of issues with burnouts because of not only the extended working hours, but yes, even because of more studied patient needs. More specialities actually which are a need of our, which becomes more stressing, and even the administrative problems actually which puts major pressure on the physicians actually, which gives them the burnout issue, which affects the quality and safety of care, because many times we find across the entire fatigue, entire stress of a physician comes on the patient and sometimes on the patient relatives. And equally, we find a lot of vandalization which is going on now currently and has been coming in news is more because of the issues that the healthcare workers are facing this. And that's the reason that public hospital encounter a lot of vandalization. So most specialists or super specialists and well-trained staff are located in tier 1 cities, and no one really wants to be going into the tier 2 or tier 3 or even in the rural areas to give services. Leaving district and block level facilities understaffed and undertrained gives a poor impression of Indian healthcare system. The primary healthcare is majorly affected because of this, and we don't come across actually that the healthcare professionals are more interested actually to work in those institutions. Neither even the nursing staff is more attracted towards working into the primary and secondary setups because of inclination that gives them a perks or even lucrative salaries to be working into the cities actually, or even to the higher cities or even tier 1 cities. Inadequate monitoring. Many healthcare facilities do not have standardized tools or indicators to measure the clinical performance, and this is a major problem actually that we come across, that the patient outcomes are usually connected with the clinical performance. Error rates or patient satisfactions are very interconnected things where inadequate monitoring is very important. Limited use of EHR, electronic health record or electronic medical records, is not only this thing that the patient has to take care. It is completely with the hospital or healthcare facilities that they need to work on developing this. Disjointed data collection, where we find that most of the time the data collected is also poor, or sometimes the data feeding is itself very poor, or sometimes we find that the way that the data collection is being collected actually or even being stored, and even the privacy issue makes more disjoint data collection, and it is very difficult that we can say that the data which is also collected gives more chances for the analysis part. Poor inoperability actually make it hard to maintain the continuity of care. The entire gamut actually of continuity of care revolve around all these things. The interconnectedness of this, if it is not there, it is also affecting the performance of the care. So regulatory oversight is inconsistent across the states. We do find that there is a gap actually with the central and the state policies. No doubt actually the entire responsibility of the health goes to the state, and the state has to take this. Many times do we find that facilities do not regularly conduct audit or even quality assessment, or audit with respect to quality are not always a stake for the health administrators or the hospital administrators. Especially the responsibility lie on the higher authority to conduct all this audit, or the internal quality team can also take initiative to conduct these audits. Errors, complications and adverse events often go very unreported, and we do find that a lot of undocumented things actually fuel this issue, and sometimes it becomes a culture. Preventing learning and improving the system is one a need that the public hospitals or even private hospitals in India need to take a great lesson about. Now, we'll talk about the Indian government initiatives which are taken, and sometimes it is found to be very promising that the Indian government under the leadership of Ministry of Health and Family Welfare has developed through the efforts of NHSRC the NQA standards, the National Quality Assurance Standards. The Ministry of Health and Family Welfare in India has started several certification programs to improve the public health services, which is highly very appreciated, and we do find that the current improving status of public hospitals and healthcare settings in India is only because of these promising efforts. This program aims to strengthen the public health facilities by improving structure of operations and service delivery. The trilogy of the improving structures, the operation processes and improved service delivery goes actually into the credit of these initiatives. NQAS and all the programs that are led by Ministry of Health and Family Welfare and the different state Governments in the entire country and the union territory implement all these varying ways. It is being majorly emphasized on giving training to all the states and union territories. Quality is the most important part of services at any health facility is what is actually being seen in INQUAS. The Ministry of Health and Family Welfare supports the quality assurance program that meets public health need and it is sustainable, which is very important to think on the sustainability part of that and where NQUAS waves actually a major importance to see that the facilities are improved day by day. It is promising giving training actually to healthcare workers and even emphasizing that the role of the patient also comes in improving these cares. The quality assurance program focuses on increasing patient satisfaction and rebuilding trust into the government healthcare services. If we do come across and meet patients actually in the public health setting, the major problem is with the trust. And quality initiative builds the trust, increases the trust. It gives the patient to give more chances that the patient comes into the focus and the patient are given more importance. It is to be seen that a lot of the healthcare communication which has increased is more because of the NQUAS efforts. The National Health Mission has launched the National Quality Assurance Standards to improve cleanliness, sanitation, infection control, biomedical waste management and clinical practices. So if we do see the interconnectedness of all this has a major role to affect the healthcare outcome of the patient, improving the health and well-being actually. This program helps create uniform standard for healthcare practitioners across the country and uniformly it is taking ahead the country. The key components of the quality assurance in public health institutions include setting up standards and measurable elements, which is the very first and very prime importance of taking this activity ahead. Assessing the health facilities against the established standards, because when the standards are established you have to assess it, and it is not that it is the one time process but it has to be continuously assessed. Identifying the problem, because healthcare is a very unprecedented situations they face, and we find that it is not that the patient but the patient relatives, and there are a lot of things which may come that you bring the problem again and again. And preparing and implementing an action plan if do we find that if the problems are persisting, or sometimes you have to do an root cause analysis, or sometimes you have to even take the PDSA. The Kayakalp initiative that I would like to talk about, which is more of cleanliness and infection control. The Kayakalp scheme is an initiative by Ministry of Health and Family Welfare, and it's very promising and very improving towards the need of healthcare institution, which is very important for Indian public hospitals and healthcare settings. The Kayakalp program or the philosophy improve cleanliness and the quality of healthcare facilities in India. It was launched in May 15, 2015 as a part of the Swachh Bharat Abhiyan. The SBM mission is also very supportive actually to this. The scheme aims to promote hygiene, infection control and eco-friendly practices in public health facilities. We do find that the Kayakalp scheme has helped a lot actually to the public health facilities to improve and give more efforts actually for that part. It rewards the public health facilities that show excellent performance, and it is just like a competition actually towards the cleanliness and infection control. It is not only putting actually the competitiveness but improving and appreciating those institutions which gives more continuous assessment. The peer reviews of hygiene, sanitation and cleanliness, which are very interconnectedness actually to give the quality of care, is more a part to reduce infection, to reduce hospital acquired infection, to give major patient satisfaction, to improve the monitoring part actually, which is very important for quality assurance. So what does Kayakalp does? Kayakalp helps develop share sustainable practices for better cleanliness and which is linked to the improved health outcomes. The Kayakalp assessment follows a three-tier processes: internal evaluation, peer evaluation and external evaluation. Each health facility is assessed, it is scored and documented at the start of every financial year using an assessment tool. So it's a very systematic process to go and see that the institutions are developing their own quality and quality programs. Through all these efforts, the Kayakalp really gives the cleanliness and infection control to a very high age. The facility performance is also measured, and the parameters on which the performance of the facilities would be judged are the areas like hospital cleanups, sanitation, waste management, infection control, support services, which is very key and very important to see that the healthcare facilities are taking quality initiatives. Hygiene promotion. Awards are being given for the institutions which are being recognized, two best district hospitals or two best healthcare centers, sub-centers, and one best primary healthcare centers in each district. This is very important to initiate the quality performance. So thank you for this and look forward to you all. Thank you.